Hi, my name is Catherine Wilson, and today I will be explaining to you the physical effects of anxiety on the body. Anxiety is defined as a mental health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily life. The actual causes of anxiety aren't really understood, but it's said that speculated causes are traumatic events or even genetic factors, and sometimes the presence of anxiety can be indicated of a underlying health problem such as a thyroid issue, which is just hyperthyroidism, where your thyroid produces too much of one chemical, which can lead to anxiety. And it is also said that people who have depression or other health problems such as stress management are also more likely to develop anxiety. It is also speculated that anxiety is caused by a imbalance of brain chemicals, so medications can help regulate the distribution of those chemicals, such as serotonin. Anxiety itself can be characterized into different categories depending on what type of anxiety you have, such as social anxiety, which is the fear of just everyday situations, or post-traumatic stress disorder, which can develop after a terrifying event or experience, and then obsessive compulsive disorder, which can be triggered by repetitive behaviors or reoccurrent unwanted thoughts. And then there's generalized anxiety disorder, or GED, which is the most common form of anxiety disorder, which is just plain anxiety just as a whole. Physical symptoms of anxiety include feeling nervous, restless, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, hyperventilating, sweating, trembling, feeling lethargic or weak, trouble concentrating or thinking of another thought other than the present worry, trouble sleeping, headaches, tense muscles, upset stomach, irritability, and feeling burnt out emotionally. Anxiety can also affect the body mentally, as well as with psychological symptoms such as excessive worry, feeling on edge, mind racing, difficulty concentrating and memory issues, impatience, forgetfulness, procrastination, panic attacks, and needing reassurance. Ways that you can help manage anxiety depend on person to person or what type of anxiety disorder they have. But some of the most popular ways to help manage anxiety are learning meditation practices such as breathing exercises, or just learning how to relax your muscles one by one using meditation. And then you can also take anxiety medications such as SSRIs, which is selective serotonin reuptake inhibitors, which help to treat depression but are also effective for anxiety disorders as well. There's also a handful of helpful handheld tools, such as a touchstone, which is what I have right here. As you can see, it's a rock with a small indent in it, which is pretty much the size of the pad of your thumb. And so a touchstone is just one of the many things that you can just kind of hold and just fidget with, such as rubbing your thumb back and forth on it, or just, feeling the smooth surface and stuff like that. It's one of the things that I personally use to help calm down my anxiety because it's discreet enough to where I can carry it anywhere and you won't really be able to tell because it's small. And it just personally helps me. I use it whenever I'm at work, just in case if I get overwhelmed with work or something like that. And then another favorite of mine is the use of a stress ball, which helps just give you something to kind of squeeze on. And since the task of squeezing is pretty mindless, you can just continue to squeeze it over and over and over again until you feel better, which I find very helpful because eventually after squeezing it, it'll just get your mind off of it, and that helps just kind of calm you down if you're not thinking about constantly what's worrying you. And anxiety as an illness can be very debilitating, so just having any sort of stress ball or touchstone or just anything that really helps you can help get your mind off of it, and it can be very beneficial in the long run. Also, another way that I find helps anxiety is seeing a therapist or going to a psychiatrist to help limit some of the physical and psychological symptoms. Therapy can help with both of those, since therapy can help target the root of the cause, and it can teach you breathing exercises, which can help you like physically calm down, and then it can also help, like just deep breathing. And then seeing a psychiatrist is basically the doctor who prescribes medications such as Zoloft or Prozac or Xanax or any of those type of like medicines that help kind of calm your anxiety down, which is really good. And since I struggle with anxiety personally, I use a combination of both therapy and medications to help my own, as well as a heart rate tracker in the form of my Fitbit, since the way that my anxiety personally manifests is with my heart rate. So like whenever I get really anxious, my heart rate will skyrocket. So just having something that helps me keep track of it allows me to know whether or not I need to take additional medication, or if I just need to like squeeze a stress ball or something and just kind of get my mind off of it. And speaking from personal experience, anxiety is not a disorder that should be taken lightly, as it can be harmful to the body as well as the mind. It is very just debilitating, and it's very hard on you, and you're just constantly at war with yourself. And so having ways to help manage it and just informing yourself of anxiety can help you as well as others who struggle with it, because you can suggest to them, hey, try some deep breathing, or hey, take a breather, stuff like that. So thank you for learning about anxiety with me.